Hi, everyone, and welcome to the Center for Innovation in Campus Mental Health webinar series. We're just going to take a half a minute for people to slowly roll in before we get started. Thank you so much for joining us today. All right, so the topic we're going to be covering today is quality improvement in student services, how to improve mental health care for post-secondary students. So just a little bit of housekeeping before we get started, in case you've never attended one of our webinars. Participants are on mute while we're on the call. That means you're on listen-only mode. If you have any questions for the presenters or maybe for the host, please type them in using the question function on the menu, or you can chat using the chat box, this little chat function there. We're going to start taking up questions around 1:45, but feel free to just type in questions as they come up to you, and we'll start taking them up around then. The webinar is being recorded and is going to be made available on our website, and the presentation slides are available to download right there under handouts, and you see there are also two other handouts that our lovely speakers are going to be talking about in a little bit. We do have a short survey at the end of the webinar, so please take a few minutes to complete it, as the feedback is really valuable to us. And just like to introduce myself, my name is Perlin Ng. I am the Research and Knowledge Exchange Coordinator for the Center, and we are joined today by Jenna Hitchcock and Alexandra Clement. Thank you so much for joining us today. And right now, I'm just going to turn it over to both of you.
Great, thanks so much, Perlin. And thanks for that introduction. My name is Jenna Hitchcock, and I'll tell you a little bit more about my role in a few minutes, but I am with the Excellence Through Quality Improvement project, and we're really excited to be here today to talk to you about quality improvement and to get you thinking about how some of these methods and tools may be of use to you in your student services role. So Perlin did touch on this before, but if you are having trouble hearing us, we recommend that you phone into the audio line that's in the orange box on the screen. We find that with GoToWebinar, sometimes the computer audio can be a bit choppy, and often it's more clear if you dial in using a phone line. So that is a piece of advice for you as we work through today. As Perlin mentioned, we're open and happy to answer questions as they come up, so please type them in as they come to you. We'll also have a few engagement opportunities for you throughout the next hour for you to share a little bit more about yourself and to reflect on some of your current improvement experiences, and we ask that you type in those responses in the chat box or through the polling question that will pop up in a few slides. All of the handouts that we'll mention today are in the handout section of your GoToWebinar window, as well as the slide deck if you'd like to use it at another time or share it with some of your team members in your organization. So to get things started, my name, as I mentioned, is Jenna Hitchcock. I'm the program manager for E-QIP, or the Excellence Through Quality Improvement project. I've been with E-QIP since the beginning. We've been around for about 2 years now, and we'll tell you all about our initiative in a few slides. But my role is really helping with the training program that we deliver to the community mental health and addiction sector to inform them about QI methods and tools, as well as manage our online community of practice, where we have discussions as well as host resources for the sector.
And my name is Alexandra Clement, and I'm a quality improvement coach with the Excellence Through Quality Improvement project. I've been a coach in both the data and quality improvement roles between the 3 cohorts, and I'm very happy to be here today to help walk you through the model for improvement, which is the framework that we use with our participating organizations that are working on their own quality improvement projects.
Great. So our first question for you is to let us know a little bit more about yourself. So we're asking you to let us know how many people are with you today, if it's not just yourself that has called in. It helps us keep track of the reach of our webinars, as well as what college or university are you representing today. I'll give you a few seconds to type those in.
So feel free to answer this in the chat or in questions, and I will read them out. All right, we have one person from Portage College in Alberta. I hope I'm saying that right, Portage College. And University of Guelph, Confederation College in Thunder Bay, Lakehead University, University of Calgary, Wilfrid Laurier University, Fanshawe College, Georgian College in Orillia, Trent University, University of Victoria. Oh, we're very widely spread out today.
All right. Okay, so thank you so much for joining and sharing a little bit about where you're from. It's really exciting to hear about all the different locations that are calling in today. So our goals for today are really to let you know about some of the background about quality improvement in healthcare and why it's important. So I'll give a little bit of a kind of brief history of what brings us to quality improvement and why it's making a big movement across the healthcare system and services in Ontario, but also kind of on a global scale as well. And then Alex and I are going to be sharing some experiences with you on how we've used quality improvement methods and tools with community-based programs that we work with. And then hopefully throughout the next hour, you'll have some opportunities to reflect on how some of these principles can be applied to the work that you do with students and how you might want to use some of the tools in future work. And so this is really going to be a very quick crash course in quality improvement. We do full days on this content, and there's lots of different areas for you to explore after today to continue your learning journey in quality improvement. But we hope to inspire you and to get your creative thinking going in terms of how you can use this in your own work and improve the care that you provide students in your universities and colleges. So to start things off, I'm going to talk about a little bit about why quality improvement in healthcare and why it's important and where this whole idea of continuously improving care and experiences for the people that we serve came from. So I won't read this slide in detail. It's just to give you a sense of the QI movement in health and healthcare services. In the early 2000s, there were a few reports released that basically shed the light on opportunities in healthcare to prevent avoidable injury or missteps in healthcare. So a few different reports came out in North America. One did come out in Canada about looking at all the adverse events, and by that it's all about medical errors and incidents that may lead to patient harm. And so with the release of these reports, people working in the healthcare and providing services to clients and patients, came together and said, okay, we know that there's problems in the healthcare sector. There's lots of things that we can be doing differently to make sure that, we are providing the best care and we're not hurting people more in our care than not. And so this whole kind of shift in mentality happened across healthcare over the last 15 or so years, where people really opened their eyes to the systems that we're working with and wanting to strive to be better and make sure that people were receiving the best care possible when they came into a healthcare organization's doors. One of the biggest shifts over that time period has really been a more systems approach to thinking about care and care delivery. And so before, it was more about, competencies and provider competencies and making sure that people are really well trained in what they're doing, whereas the QI movement is really letting people know and think about what are the systems that we're working in, what are some of the barriers, based on the systems and organizations that we're working on in, how are those factors impacting our ability to provide high quality care. So that was a really big shift in thinking for healthcare in general, and a really big key to the quality improvement movement. And then with that came a bunch of QI frameworks and methods to help people improve care and experiences. If you're brand new to QI, you might not have heard of some of these before, but if you're not, they're fairly well known in improvement work. They come from industry, so Lean, Six Sigma, and the Model for Improvement were all explored and adapted to work in healthcare settings. And so that's, in a really high level way, kind of why we're talking about quality improvement, and where it all came from in healthcare. As I mentioned, there was a lot of shifting from, thinking about quality of care being the responsibility of the provider that's providing that point of contact for individuals seeking care, to thinking more about, okay, what are the systems that they're working in that are either preventing them or enabling them to provide the best care possible. That was one big shift, but also just kind of more broader than that. Quality control was kind of an older way of doing things. It doesn't mean that quality control is not important, but quality improvement is really taking what we know and acting on it and making sure that we're continuously improving care. So in quality control, it's thinking about, are you complying with standards, inspection, so it's thinking about, people coming in and observing whether or not those standards are being complied with or not. The attitude is often that, this is the way that we have to do things, and if it's discovered that people aren't providing care in a specific way, there's often feelings of defensiveness that arise through quality control approaches. As I mentioned, it's the individual responsibility to comply with standards and make sure that they're providing care that are compliant with those standards, and it's really just about the care provider, and it's the responsibility of a few. So that's quality control. I think there's definitely a place for that. So especially when we know about what makes high quality mental health care, for example, it's important that we look to see what the standards are, what is best practice, and compare ourselves against those to see where there might be room for improvement. But then if you look on the right-hand side of this chart, quality improvement is all about understanding how we're providing care, where the problems are, and continuously working to improve that. So if we stick with the standards example, if we have a standard that we're trying to meet and we're not meeting it, why aren't we meeting it, and what are some steps that we can take to make sure that we're meeting those standards in a really action-oriented way? If we are finding that we're meeting our standards, how can we go beyond that and make sure that we're providing care above and beyond what is required of us? Quality improvement also really promotes prevention, so looking at where your problems are to prevent them from happening either again, or maybe even seeking out where there's potential for risk to happen and reducing some of that through quality improvement work. It's also a chosen attitude, and it's proactive in nature. Again, it's all about thinking about systems and processes that we have in place that either let us do and enable us to do good quality work and provide good outcomes for the people that are seeking our care, and what are the systems that are enabling or creating barriers for us to do that. Quality improvement is all about client care, really understanding how the client is experiencing the care that you're providing them, but also the outcomes. So our clients that come to us actually achieving the outcomes that we want. And we often find in mental health and addiction services, that one is often hard to do. It's really hard to define what a good quality outcome is for clients, but quality improvement encourages us to try and quantify that and really understand if we are providing good care and good outcomes for everybody that we're serving. And again, it's the responsibility of everyone, not just a few providers. So this is how the E-QIP team defines quality improvement in healthcare, but it's also how the province and Ontario and much of healthcare nationally also defines healthcare. Quality improvement is really all about getting those good client experiences every time somebody walks through our doors or receives care that we're providing to them, and also that outcome piece, so making sure that people are actually getting better and moving towards their recovery goals. If it's a mental health and addiction service that you're providing, how are we actually making sure that we're achieving those things for the people that we're serving? There's also a large aspect on provider satisfaction and making sure that the work that we're doing is making the individuals that are providing that care, enhancing their satisfaction with their work, as well as the whole notion that everybody plays a part in quality improvement. So once we know what problem we're trying to address through a quality improvement initiative or project, who are all the stakeholders that need to be involved and might have something to say on that issue, and it's really inclusive and tries to make everybody part of identifying the problem, but also part of the solution. So a little bit of Ontario context for you. As I mentioned, this is a really global movement in all healthcare, in North America, but also across the world. In Ontario specifically, and I know that we have others on the line, but in Ontario specifically, there was the Excellent Care for All Act that was passed in 2010, and this piece of legislation was really all about making sure that healthcare organizations are continuously looking at the care that they're providing and making sure that they're improving that care on an ongoing basis. Out of that act came Health Quality Ontario, which is the provincial advisor on quality, and their role is really to report out on how the healthcare system is achieving good outcomes for the patients and clients that we're serving, and how we're working together to make sure that we're continuously improving on those outcomes. They also do things like support people in QI initiatives and projects through education and resources and things like that. They're really the provincial voice on quality improvement and drive a lot of work that happens in the province. And I think just in general, healthcare organizations in Ontario are trying to take steps to be real improvement champions and continuously work on problems that are impacting patients and clients that we're serving. So in Ontario, I think that piece of legislation that happened in 2010 was a real big instigator for us as a healthcare system to take note of what we can be doing differently and committing to continuously improving our healthcare system and services. So this is a really important slide for you to consider, especially if you're new to quality improvement. These are the 6 domains of healthcare quality, and essentially they're fairly well used and leveraged across the globe. And the thought is that if we start a QI project or initiative based on one of these 6 domains, we'll be moving towards a higher quality healthcare system and higher quality healthcare services in whatever organization or jurisdiction that we're working in. So the first dimension of what a good health system or health organization provides clients or patients is safety. And it's all about making sure that the people that enter our doors are not being harmed by the care that we're providing them. So that's the first dimension of a high quality healthcare system. The second is effective, and this one's all about making sure that we're providing the right care at the right time, and the care that we're providing is evidence-based and up to date. And effectiveness is really all about making sure that what we're providing is achieving the outcomes that we're hoping to. The third dimension is client-centered, and really what this one's all about is making sure that we're respecting the people that we're serving when they're in our care. We're respecting their choices, and we're respecting their preferences for healthcare. So we provide them with different options, and we work with them to make the best plan forward for them based on their needs and their preferences. Efficient is really all about making sure that we're using resources in our healthcare system well, making sure that people are working together. So if you are working, with community partners in the work that you're doing, making sure that those communication channels are strong and the integration of services between providers is efficient and used well. And then the timely dimension is fairly straightforward. It's all about making sure that people are getting services in a timely way, and we're not putting them through long wait times that don't need to be there. I know that in speaking with Perlin, that's a big issue on campuses, and I encourage you to think about that dimension in terms of your wait lists. And equitable is all about making sure that we're serving everyone equitably. So it doesn't matter where clients live, it doesn't matter their age, their race, their gender, their socioeconomic status. We're treating everybody equitably and making sure that we're getting care to everybody that we're responsible for through the work that we do. So this is our first poll, and with all that said on the introduction to quality improvement in healthcare, I just want to take a minute to ask you, have you worked on a quality improvement initiative in the past to improve care for students of your mental health services or programs?
Okay, I'm going to close the poll now. I'm not sure if you can see the polling results. Jenna, can you see the polling results?
Yeah, I can.
Great.
So it looks like 40% have worked on a QI initiative before, 24% haven't, and 30% are thinking about it. So that's really great, and I encourage you, if you've answered no, to think about as we work through, and Alex and I share some information on some of the tools and methods that we use, how you can apply that to the work that you're doing. If you have worked on one before and you're fairly familiar with QI, hopefully this will be a refresher for you and perhaps motivate you to continue working. And if same for those that are thinking about QI, it is a really great tool to use, and the method that we're going over with you today is really widely used in healthcare and services for individuals. So I encourage you to reflect on that as we work through the rest of the presentation today. And this is a slide we like to raise for you, again, to have that reflective piece coming out of today. As healthcare professionals, or in your case, people that are providing care to students through mental health care, but also through, I'm sure, a whole host of other services that you provide. How often do you provide care, and how often do you take time to think about improving the care that you're providing? And often what we hear from service providers is that we're really good at providing care, and that is our main job. But it's, throughout your career and once you start working in healthcare, it's also important for you as a provider, and for us as a healthcare system and organizations that are responsible for providing that care, to sit back and reflect on how we can do better, and where are those constant problems that keep cropping up, and how can we be moving forward and always be improving to better serve the people that are seeking our services. So I hope that you'll take some time to reflect on that, and think about where there might be some opportunities for you to sit back and look at how you can provide care to the students that you're serving. So I'm going to pass things over to Alex now.
Thanks, Jenna, for that lovely introduction to quality improvement in healthcare. And I'm going to take an opportunity for the next few minutes to talk a little bit about quality improvement in Ontario's community mental health and addiction sector, which is often considered to be kind of the younger sibling of the health sector, although we do share those responsibilities in providing care and improving care, much like health. So when a survey was sent out in the Ontario's community mental health and addiction sector to kind of see where organizations were at with quality improvement, Some of the findings were, I'd say, a little bit shocking, where we find that 78% of organizations don't have dedicated quality improvement time, which really kind of echoes the thoughts of quality improvement being something that's done on the side of the desk oftentimes, where, like Jenna said, we're really focused on providing that high quality level of care, but we may not necessarily have a lot of time or resources to work on the improving care portion. We also found that 44% of organizations don't have quality improvement friendly data systems, which is a really important thing to have when we're talking about quality improvement, because without data, it's very difficult to understand where exactly there may be room for improvement, or where there's some areas where we're doing really well, maybe some areas that once we find that baseline information, we can see if we can make any gains there. And 62% of organizations don't have formal quality improvement policies. And when we talk a little bit about sustainability as we go through the rest of the slides today, you may see that we talk about sustainability as being something that should be embedded throughout quality improvement. And without having formal policies and procedures, it's really difficult to see that embedment happening at organizations, which again kind of makes it difficult to have it be something that's really well established and focused within your organization, because they don't have that foundational groundwork set up. Again, when we did our E-QIP survey in 2016, we got some information from community mental health and addictions organizations. 76 responded, and again, this is Ontario specific, but the hope was to just gain a little bit more insight as to where organizations felt they were at in their quality improvement journeys. And as you can see on sort of the right hand of the pie chart here, about half the organizations stated that they were in the exploration and installation kind of stages of their journey, whereas quality improvement was something that they were aware of, and it was something that they wanted to perhaps do at their organizations, but they may not have the necessary resources, foundation, or time to do these types of things. So I know in the last poll that we just had, about 36% said they were thinking about doing a QI initiative, and so they may be in this exploration or installation portion. So exploration, again, being there is some commitment to QI, but there may not be any kind of foundational training, lack of dedicated resources, lack of data, etc. Installation, that's the phase where you start to see some of that groundwork being laid. So maybe an introduction to QI training, it might be informal. Somebody may be doing some QI work on the side of their desk. It's starting to be a conversation at the board potentially. And then we see that a few more organizations felt that they were at the implementation stage, where quality improvement work was something that they were doing on an ongoing basis, but recognized that there's still a lot of areas where they can improve as an organization. And it may have something to do around, again, that QI training, embedding it in their policies and procedures, looking at annual QI plans or their data systems. And then 16 organizations said that they were at the adoption phase, where they felt that they had a pretty firm understanding of what QI was, training was happening on a regular basis, annual QI plans were being used, ongoing QI projects, and they could be considered sector leaders in quality improvement. Which, after saying all that and recognizing that there is a need for some capacity building around quality improvement in the community mental health and addiction sector, E-QIP was born. So E-QIP is the Excellence Through Quality Improvement project, which is a partnership between Addictions Mental Health Ontario, Canadian Mental Health Association Ontario, and Health Quality Ontario, which the hope was really to promote and support quality improvement in the community mental health and addiction sector. Really, the hope was that E-QIP could come in and really work on that with that existing commitment to providing the highest level of quality care for our clients and families, and really working with that kind of person-centered philosophy and seeing what we could do to improve that care on an ongoing basis. Since 2016, we have been working with community mental health and addictions organizations. We've had 3 cohorts of teams that requested coaching support, which is really the bulk of what we do, as well as training and education. and Jenna is the pro there in terms of our ideas, quality, foundations to quality improvement training, as well as developing an online community of practice. So even the organizations that may not be getting our coaching support one-on-one, there's still a place where they can get together with like-minded people in the sector, share resources and tell stories and kind of work together to, again, create this capacity within the sector. And three of the primary frameworks that we work with as the Excellence Through Quality Improvement project are the Model for Improvement, the Domains of Quality, and the Quadruple Aim. So I'll just bring your attention to the right-hand side where the Quadruple Aim is, which really identifies the 4 aims that we want to reach as a mental health and addiction sector. So there's better health for the population, of course, better care for individuals, again, talking about that person-centered care, improved provider satisfaction, which we also talk about the idea of joy in work when it comes to that improved provider satisfaction. So not only are clients receiving the best quality care, but our staff being satisfied in what they're doing as well. And then the fourth being the lower cost through improvement. And if we move left to the domains of quality that Jenna already spoke to earlier, we look at equitable, timely, client-centered, integrated, effective, and safe. And those are really sort of the higher arching things that we're always trying to consider and achieve when we're doing our quality improvement projects. And then on the left, we'll see the Model for Improvement, which is the primary framework that we use to move through our quality improvement projects. And it kind of identifies 3 questions in a cycle that helps guide our work as we try to achieve those aims that are introduced in the Quadruple Aim, and again, guide us through our work as service providers and making sure that we're doing the highest quality care that we can. And I'll pass it back to Jenna to talk a little bit more about that Model for Improvement.
Great, thanks, Alex. So the next series of slides will really be looking at the how-to of quality improvement. And that's really the strength of the Model for Improvement, or the framework that we use as the E-QIP team, but is also widely used across Ontario, but also much broader than that. So this is really just to give you a flavor of what it's all about and provide you with examples of some of the tools that are involved with that model. It definitely, is not a comprehensive overview of all the things that this model has to offer, but hopefully it will give you a sense about what it's all about. And at the end, we'll go over some additional resources where you can look to get more information. So this is the E-QIP kind of model that we work with in terms of the tools that we've selected work best for our sector, as well as the stages of a quality improvement initiative or project. So I'll point your attention to the boxes in the red. These are really all about the major steps of a quality improvement project. So you'll take some time to prepare for the quality improvement project, and then there's a host of tools that you can use to really understand the problem that you're trying to address. And then through measuring and understanding your system, this is where the model really promotes the use of data and making sure that you're using data throughout the life cycle of an improvement project, both at the beginning to make sure that you understand to what degree your problem is actually happening, but also throughout, that so that you can see, are the changes that we're making actually leading to improvement. And then there's a series of tools that we use to help plan solutions or change ideas for an improvement initiative or project. And then we use the PDSA tool through testing and implementing change, which really promotes the small scale change of your ideas or solutions that will tackle the problem that you're trying to address. The PDSAs, which we'll talk about later, are really all about starting small and making sure that your change idea is working before you roll it out across the service or program. And then Alex will talk about sustainability and spread later on, which is really some tools to help promote once you know a change is working and your change ideas are leading to the outcomes that you want through your improvement project. How can you make sure that those gains are sustained and you can actually spread them to other areas of your service? So that's in a nutshell, kind of the stages of quality improvement that we work with, as well as those are promoted across Ontario as well. We also use the experience-based design approach, which is all about making sure that throughout this whole process of doing improvement projects, you're hearing from clients or the people that you're serving. So in your case, the students that you're serving, making sure that you're hearing from them right from the beginning to make sure that your focus of your project is really student or client based, and it is a problem for the people that you're serving, and also all the way to the end. So getting their input on, how can we fix this problem, and that all throughout the improvement project lifecycle. EBD, or experience-based design, also promotes getting staff feedback as well, so making sure that you're including as many staff voices as possible throughout the improvement project as well. And there's a whole series of tools that can help you explore the EBD approach, and we've done a webinar that we'll share the link to at the end if you're interested in learning more about the co-designing process. So this is one of our main tools that we use through our improvement work. As Alex mentioned, we do work with organizations on the ground to coach them through improvement projects. And this is really kind of our starting place, is to develop a problem statement. And when you're developing a problem statement, essentially what that is, one or two sentences that will help you really understand what the problem is that you're trying to address. And this worksheet is often helpful to help you do that and get the information out that will help you make that problem statement. And what it's asking you to consider is to really clearly define what the problem is. Why is it a problem for the people that you're serving? Where do you observe the problem, which is really just trying to get you to scope in on either a specific service or program. Who is impacted? So, maybe staff are impacted, students might be impacted, students' families, or student support networks might be impacted by the problem. When did you first observe the problem? So here you're trying to get a sense of how long has this actually been impacting the people that we're serving. And then how does it impact the people that you're providing care to and their families and your staff? So really trying to dig down into understanding, the impact that this problem is having on everybody that you believe that it has an impact or an effect on. And then how often does it occur? So, common issues such as wait times and no-shows, those types of problems happen every day. And that's really important to understand at the beginning of a quality improvement project. And so the strength of this tool is that it will get you to have really meaningful conversations with your staff and potentially students if you're including them in your improvement work, so that you can get all the information out and then make a really clear problem statement so that you know what the problem is that you're trying to address. And that is something that the Model for Improvement really strongly advocates for, is that we have a really clear sense of where we're starting from so that we know where we want to go. This is an example of a problem statement for a fictional organization in the community sector. So essentially it's all about the wait times have been really long, and they're increasing over the last 2 years. Clients on average are waiting about 108 days for service. And then the last sentence there is all about the impacts that long wait time has on the clients that are being served by this organization, but also by their family members. And then the staff members, when they actually receive or intake these the clients after being on a long wait list, they're actually dealing with higher complexity. So this group really understood and took the time to understand what problem they were trying to address, and they put all of that information into a nice problem statement there. So that is one really important tool that we use with our teams. This is also a really great tool that's in the handout section for you to consider, and it's really a nice summary of what a quality improvement project might look like. This is a evolving document. So when you start out with your problem and really trying to understand the problem, you'll only have certain areas of this charter completed. So when you first start, you might have the team identified, your problem statement, and perhaps some of the resources are determined. But then as you move along the process that Alex and I are going to be taking you through, you'll be able to populate your charter as the QI project moves forward. But we did like to share this tool with you so that you can actually see all the different components of what a project might look like, and to let you know that this is a really great communication tool as you're doing QI work. Another really important aspect of a quality improvement project is to have a good quality improvement team in place that will really take all the different perspectives that are important to the problem that you're trying to address, and making sure that you have all of those perspectives on the QI team. And that the teams that we work with either meet on a weekly or bi-weekly basis when the project starts off, and it's really important to have the key players at that table. Something to note here is when you do create your project team, it's all about making sure that you're open to adding individuals as more becomes known about the project. So you might think, oh, it would be really great if this perspective was included, and be open to that as you diagnose and understand your problem better. I'll note two really important roles here. The first one is having a good executive sponsor that isn't necessarily involved with the nitty-gritty and in the weeds of the project, but they're there to help if you run into trouble. They'll be there to help you if you run into roadblocks like resources or timing or things that the project team just can't overcome alone. They're usually someone in a senior leadership position that will be able to help move things forward if you're experiencing issues. The other important people to have on the team are the process owners, and these are some folks that are going to be really responsible for leading the change based on the problem that you're trying to address. So an aim statement is also a tool that we use, and all of the projects that we work with have a really good aim statement, and we coach the teams to developing one. This is your guiding light of a QI project, and so an aim statement is one kind of sentence long, and it answers how much, by when, and for whom. So if we take that wait time example from that fictional organization, our aim statement would be we want to reduce wait times to, let's say, under 20 days by March 31st, 2019. So it doesn't have to be long and elaborate. It really just lets people know this is where we're headed and this is what we want to do. And you put that timestamp on it to make sure that your project is time-bound in some way. The fishbone diagram is a commonly used tool in QI as well, and this is really where you're going to be digging down deep into that problem statement that you've developed. And so the fishbone is really just a brainstorming exercise where everybody around the table, or if you're involving clients, you can get your client's perspective on this, or additional staff that might not be part of the QI project team, where they can share why they think the problem that you want to focus on is actually happening. So you can see here that issues of long wait times, there's lots of different reasons that people believe that this is happening, including a high no-show rate. Case managers don't have time to do full assessments. There's a broad eligibility criteria for this particular program, which is leading to increased wait times, and so on and so forth. And each of the bones on this fishbone diagram is really just a way to categorize each of those problems into the 5 Ps, as we call them. And those are people, so things that are related to the people that you're serving, processes and procedures, issues related to place and equipment, could be things around your electronic systems that you're using, or the location of your programs. Policies are all about those policies that you have in place that might actually be creating barriers to providing good care. And then any issues related to staff or providers are also kind of a good category to focus in on as well. And so this is just one tool that we commonly use to get all of those root causes out. There's different diagnostic tools as well in QI, but that's just one of them. Once you have a whole host of causes that come out, you're going to want to narrow in on a few of those causes to make sure that you're focusing in on those few really important causes to that problem that will make sure that you're using your resources effectively. So there's no way, if we go back to the fishbone, that we can focus on every single one of those causes. The Pareto principle will really help us narrow in on what causes to focus our time. And so the Pareto principle is, in this context, is really letting us know that 20% of the causes are causing 80% of the problem. And essentially, the Pareto chart or the Pareto principle is going to provide us a nice visualization of how to narrow down and focus in on those few root causes. And there are templates that will allow you to do this. Often what we do in the E-QIP team is we have our list of causes, and then we get the QI team, based on everything that they know, to vote on what they think their top 2 or top 3 causes are that are contributing to the problem. And then they have data to populate this template and can have a conversation on, what are the vital few areas that they want to focus their solutions on. This is another diagnostic tool that's often used in many different settings, but definitely in QI. If you're focusing in on, let's say, an intake process because you want to look at your wait times, that's a really common one that we work with. You really want to be mapping out in a process map what are the steps required through that intake process, and that's exactly what the process map on the screen right now is doing for you. I'm sure a lot of you have used process mapping, whether it be in a QI project or not, but process mapping is a really good way to understand, A, what is currently happening, and B, identify areas that might be problematic, but also areas that are good opportunities to focus in on to achieve a particular aim that you're working towards. And then once you've done your diagnostics, you have a really clear aim statement, you know kind of the direction that you want to go in, and you're focused in on a few of those root causes. Then it comes the fun part where you actually use different tools to help you brainstorm what a solution might be to target some of those root causes. And in the model for improvement and in the QI work that the E-QIP team does, we really like to promote thinking outside of the box. So there's obviously going to be some really low-hanging fruit and really obvious solutions that come out once you understand what the problem is, but we really like to promote the use of some brainstorming tools to help you actually think outside of the box. And one of the exercises that we use is the random word exercise, where we pick a random word. In this case, the random word from a chart of random words that you can pick from was penguin, the team landed on, and then they list everything that reminds them of a penguin. So they do a bit of a word association, and then they take those associated words and they try to think of a change idea that aligns with that or kind of stems from that associated word. So if we look at the aim, they're really at this point trying to think about solutions to their problem of the case management program and how can they get that down to 10 days. And we'll just look at one example. So one association was black and white, and their change idea there was to make the eligibility criteria for their program very clear or black and white and not open for interpretation or inconsistent application. So that was the change idea that came out of that exercise. And there's many more that you can use to try and think a little bit outside of the box for your solutions. I'm going to pass things back over to Alex. He's going to take you through the family of measures. Sorry, Alex.
I think you're probably seeing a lot of desktop icons right now.
So I think you have to make me presenter.
Change presenter.
There we go.
Okay. So moving right along with our crash course in the model for improvement, we also talk a little bit about, well, actually we talk a lot about measurement because really in terms of data, everything's anecdote until we measure it. So we may think that there's some problems that are happening with, say, wait times, but it's really important to get those baseline measurements and see if the changes that we're making are having an improvement in terms of moving things in the direction that we'd like them to see. In the model for improvement, we work primarily with 3 different types of measures. And these are outcome measures, process measures, and balancing measures. And the outcome measure is really what it is that we're ultimately trying to achieve what is it that our aim is, what is our goal that we're working towards. So in the case of the fictional example we provided earlier, their outcome measure would be average number of days waiting for their referral to get to service initiation. When we talk about process measures, these are sort of measures that are looking at the inner workings of our system that are going to ultimately lead us to that desired aim. So are we doing the right things to get to the outcome? In this example, we may look at number of hours administrative staff are spending on the referral process. Is it too many? Is it too few? If we make changes there in the process itself, are we going to see those downstream effects towards our goal? We also consider balancing measures because when we make changes to a system, it doesn't really ever happen in isolation. And sometimes there's unintended consequences, which may be positive or negative. So in terms of a balancing measure, we may see changes in client satisfaction going up if we've decreased those wait times. So just kind of being aware that as we're working through our changes, that we want to make sure we're looking at not only the things that we're doing to work towards that ultimate aim, but seeing what else is happening in the system. And we've got a really helpful tool for visually displaying that information, and that's called a run chart. Very simple to use graphical display. So we plot time across the bottom and the measure on the Y or the vertical axes, and we can see over time whether the changes we're making, and you can see here some annotated changes, are having that desired effect and really working towards the aim that we're trying to achieve. And one of the tools that we use to help keep track of those changes that we're making and some of the different things that have been affected in the system, we also like to use the PDSA worksheet. So again, PDSA standing for Plan, Do, Study, Act. So making sure that anything that you're doing is very deliberate and planned. So you have some predictions and some questions that you're going to ask, as well as identifying what type of data you're going to collect and when it should be collected. The do is the carrying out of that plan, testing it out, seeing what changes are occurring. So the study would be completing the collection and analysis of data, and then comparing what information you collected to those predictions that you were going to make. Then there's the act. So based on working through that one cycle and looking at the information you've collected and the lessons learned, what needs to happen next? So what are your next steps? Does another cycle of the PDSA need to happen? And if so, what is that going to look like? And we see on the right-hand side that they talk about a couple of different types of PDSA cycles, the first being develop. This usually happens with no client involvement. So for instance, if you're working on a new form, you may just take it to another staff member and say, hey, does this collect all the information we need? How is the readability? Will this fit into our processes? Will it be easy to embed? And then from there, you can test the actual PDSA. So if it is a new form, you can try it out with a client or two, see what their thoughts are, whether they had an okay time filling out the information, seeing if things are left blank because maybe there was an issue around not understanding the questions being asked, etc. And then from there, you can decide whether you want to try implementing the new change. So again, if we're using the example of a form, this is something that you may kind of start rolling out to one staff and then multiple staff, or in one program and then multiple programs, working towards making sure it's hardwired into current practice and then easy to spread on to, again, like additional staff, additional programs, etc. Keeping in mind that as you're spreading things, you may have to adapt them to fit in with that certain service or program. I know that in Ontario, especially in our colleges and universities, there is a bilingual component, so things may not be easily translated to French from English, etc., and just making sure that you're adapting things as needed. So speaking of spread, there are two kind of frustrations that we run into when we're considering spread, and that's something that should be planned for right from the onset. So there's the improvement evaporation effect, which means a lack of sustainability. So we've made all these really great gains towards our ultimate aim. We've made some changes, things are working really well, but then things start to kind of dwindle off because they weren't really hardwired or embedded into our practices. There's also the islands of improvement effect, which is the lack of spread. So you may be seeing in certain departments or certain programs, things are working really well. Say, for instance, wait times are really low, but there's kind of a lack of understanding as to what they're doing to create that improvement and why it's not being spread to other locations or services. So we do have a tool to kind of help plan for that. So it's the NHS's Sustainability Guide. So this is actually in an Excel spreadsheet. What we normally do as E-QIP teams is we give a copy of the form to each one of the project team members. They fill it out on their own, and then they bring back the results. The form itself asks questions around infrastructure for sustainability, fit with organization's strategic aims and culture, clinical leadership engagement, senior leadership engagement, etc. These being factors that are really important for the success and ultimate sustainability and spread of a project. And then you can see here that the maximum score is in the gray bars, and then the survey response, whichever the project team member indicated, the level at where they're at for the organization, shows up in blue. And this sort of elicits a conversation between the team members as to why some people may have scored, say, infrastructure for sustainability low, while others may have done it high. And it really just indicates early on where there may be some barriers to sustainability and success with the project, so those can be planned for well in advance. And really, that's the model for improvement in a nutshell. We can see here again sort of our linear model for improvement with the different QI stages and tools. Jenna walked us through preparing for QI, introducing the problem statement and project charter, as well as understanding the problem with all those lovely diagnostic tools, the fishbone diagram, the Pareto chart, the process map. We talked a little bit about measuring and understanding your system with the family of measures, as well as run charts, developing and planning solutions with those change ideas, introduce PDSA worksheets, those plan, do, study, act cycles for the testing and implementing the changes, and looking at sustainability and spread and how we really need to consider that throughout the duration of our project to ensure the success and the long-term efforts are carried out and held within your organization. So again, that looks very nice and linear, but just to remind folks that that's kind of our quality improvement goal. But in reality, this is a very iterative process. It's very dynamic. Oftentimes people need to work through one stage. They may advance to the next only to realize that they need to go back because something was missed or new data has become available and things need to be rethought, whether it be the problem or the diagnostics. And just, again, kind of embracing that process and realizing that it's not going to necessarily go from step A, B, C in a very linear fashion. So just a quick question. I realize we're getting short on time, but we were hoping to know what are some of the common issues impacting the quality of mental health care that is being provided to your students. You may think about things around the dimensions of high-quality healthcare services that Jenna introduced earlier. For examples, are there issues impacting student experiences when receiving mental health services? Is there issues around staff and student engagement? Is there issues around ensuring effectiveness and efficiencies of care? Talking about no-shows. How about service integration with other supports, other things available in communities? And any issues around perhaps timeliness of care provision, as well as equitable care provision. So if you would just like to put your thoughts maybe in the comment box.
All right, we just had somebody say staff and faculty engagement, as in the lack of staff and faculty engagement.
And I think in some of we've also heard about lack of timeliness, so possibly wait times and wait lists to get into service, as well as maybe some issues around equitable care. So maybe the differences between students who live on campus versus off campus. And I think just for the sake of time, we'll keep going, but please, if you think of anything else, we would love to hear more about it, because that definitely helps us add some more context to our presentation. So those that indicated they're thinking about QI, and it's something that's on their mind and something that they want to start doing more of at their organization. Just some tips, and I think we sort of had these kind of embedded throughout our discussions today, but try and think about what it is you're hearing from students, because these are the ones that ultimately the services are directed towards, and their perspectives as kind of like the client and the recipient of these services should really be what's ultimately driving the improvement. Could be things around if the reception area may not be set up in a way that's really conducive to an inviting or friendly environment. It could be really anything, which leads to the next point. Start small, keep it manageable and clear. These really do make for better QI projects. One of my coworkers says that you don't necessarily have to try and boil the ocean. It could be as simple as just moving a garbage can. Like, that could be considered quality improvement if it's making a service experience better for an individual. Be open to the QI process. So take the time that's needed to really look at the problem, diagnose the issues, and not jump to solutions. Because the last thing we want to do is really address symptoms of a greater problem, because then it ends up just being a Band-Aid fix, and it doesn't really have those kind of sustainable long-term effects that we're looking for. Next, you really want to embrace data, whether it be quantitative and qualitative or a mixture of the two. QI really requires this information, because then you can see how changes are really affecting the system over time, whether it's kind of driving you towards those intended improvements or having those unintended consequences throughout the rest of your system. And then understand existing enablers and barriers in supporting your QI work. And just a little bit more on that, we talked a little bit about this with our sustainability guide, but things on an organizational, a staffing, and a process level that you really want to consider are things like infrastructure, clinical leadership, engagement, and support, staff behaviors towards sustaining the change, and then in terms of the process, effectiveness of the system to monitor progress, and the credibility of evidence, because ultimately these are going to help you make those changes and ensure that they're sustainable and easy to spread on to other departments. Because once we do see successes in getting towards our ultimate aims, we want to really celebrate those things and share them widely and make sure that we're keeping the momentum going. And I think on that note, we would like to open it up to any questions. I know we're running a little bit behind today, but we'd love to hear from the audience.
All right, so if anyone has any questions, feel free to type them up in the question function. And then we actually had another response from the earlier question you posed. So someone did say lack of faculty and staff engagement, and we also had another response saying it's the dissonance between faculty and students, so self-advocacy skills improvements are needed. Do you both have any thoughts on that?
I have a few thoughts on the engagement piece, and Alex, please feel free to add to this. But I think on that, QI is often a really great way to engage people in a meaningful way. So you can either, look at why you're having issues with student or staff engagement and shaping your programs and services. I think that is a valid issue to focus on. But you can also look at things from the way of, a QI project might be a good way to either ask people to be part of a QI project team, or use the EBD, experience-based co-design approach that I mentioned previously, and there's lots of different resources for that to explore ways that you can bring people in QI is so, we promote really targeted and specific projects, so it's often a really great way to engage people where they can actually see how their input is being used to improve care. So I would just encourage you to think about QI as a really great way and method to foster engagement, I guess, with your students and staff.
Amazing, thank you. It seems like that's all we have for now. Maybe we'll wait just a short little bit longer before we wrap up to see if anyone else has any questions.
Sure. Maybe while we're waiting for Lynn, I'll just go through really quickly some of the additional resources.
Yeah, absolutely.
Oh, all right, great. So we know that this was very quick and a very fast overview of QI, and as I mentioned, we can kind of talk for days on this and still not have really gotten too deep into it. It's a really big topic. So just some additional resources for you to consider. The first is the E-QIP Community of Practice, where anyone can join. It's an online platform to get resources that are specific to the model for improvement, but also community mental health and addiction care in the province of Ontario, but if you're beyond that, you're more than welcome to join as well. We have online discussions as well as we host all of our resources, tools, and templates on there. So I encourage you to explore that option. All of these are hyperlinked in the PowerPoint PDF that you can download from the handout section. The other really great resource that we have is our Quick QI webinar series, where we go through the model for improvement in much more detail. We go through each of the tools that the E-QIP team use and how to use those in an improvement initiative or project. And so I, again, encourage you to look through that series on our YouTube channel if you want any more details on the model for improvement and some of the tools that we went through today. We also have additional webinars coming up that you can look through. If you click on the hyperlinks to register, there's a bunch more information on what to expect at each of those events. We also have all of our past webinars archived on our YouTube page that will go into much more detail about what Alex and I gave you an overview of today, including the experience-based design. Webinar 8 is a really popular one, so I encourage you to look through that if that sparked your interest there. The E-QIP team also has a newsletter. If this at all has piqued your interest and you're really eager to become an improvement leader in your place of work, please do sign up for that newsletter. We do provide bi-monthly updates as well as whenever we have upcoming trainings or events, we let people know through that communication. And this is the contact information for the E-QIP team. My contact information is the last one there, but our program directors, Mike and Debbie, are always willing and available to talk about quality improvement. So please reach out to us if you have any further questions. And then there's a SurveyMonkey link there that'll ask you a few questions about the webinar today and your experience with us.
All right, so it looks like we don't have any further questions, although we do have a comment that this was a very informative webinar. So thank you so much, Jenna and Alex, for sharing your work and your knowledge. And to all of, oh, sorry, did I interrupt you?
I was just saying thanks for having me.
Yes, and to all of the people who are still on the webinar, a recording of the webinar as well as the presentation slides are going to go out tomorrow, and please fill out our post-webinar evaluation survey, which is different from the survey that is currently on the screen. So a lot of surveys for you. This is our last webinar for the year, but we will be returning in January to talk about mental health stigma with athletes, and we're going to be talking about a program called Talk Today. So again, thank you so much, everyone, and we will see you in the new year.